Imagine a family dinner, laughter filling the room, when suddenly a loved one slumps in their chair. Their smile turns into a droop, their words become slurred, and their arm goes limp. This, my friends, is the stark and sudden reality of a stroke. A stroke, often called a brain attack, occurs when the blood supply to a part of the brain is abruptly interrupted. This interruption deprives brain cells of vital oxygen and nutrients, causing them to die within minutes. Recognizing the signs of a stroke and seeking immediate medical attention is paramount. The faster treatment is administered, the greater the chance of minimizing brain damage and improving outcomes. Time is of the essence. Every second counts. The human brain, a complex marvel of nature, relies on a constant supply of oxygen-rich blood delivered through a network of blood vessels. When this delicate balance is disrupted, the consequences can be devastating. A stroke occurs when a blood vessel supplying blood to the brain either bursts or becomes blocked. This blockage or rupture deprives brain cells of the oxygen and nutrients they need to function, leading to cell death and potential brain damage. Recognizing the signs of a stroke early is crucial, as prompt medical attention can significantly impact a person's chances of survival and recovery. Course of treatment. The impact of a stroke on the body can be profound and varied, depending on the area of the brain affected and the extent of the damage. Paralysis or weakness on one side of the body is a common symptom, along with difficulties with speech, swallowing, and balance. Cognitive impairments, including memory loss, difficulty concentrating, and emotional lability, can also occur. The sudden onset of these debilitating symptoms can be overwhelming for both the stroke survivor and their loved ones. In the realm of stroke care, time is not just a measure, it's a lifeline. The faster a stroke is diagnosed and treated, the greater the chances of limiting brain damage and improving functional outcomes. Early intervention is crucial because within minutes of a stroke, brain cells begin to die due to lack of oxygen and nutrients. The longer the brain is deprived of blood flow, the more extensive the damage, potentially leading to long-term disabilities or even death. Medical professionals emphasize the concept of a therapeutic window, a critical period during which specific treatments can be most effective. Knowing the signs of a stroke and acting quickly can make all the difference. The FAST test is an easy-to-remember acronym that can help identify a stroke in progress. Face drooping, ask the person to smile. Does one side of their face droop? Arm weakness, ask the person to raise both arms. Does one arm drift downward? Speech difficulty, ask the person to repeat a simple sentence. Is their speech slurred or garbled? Time to call 999. If you observe any of these signs, even if they are temporary, call 999 immediately. Foods low in saturated and trans fats, cholesterol and salt. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Stroke is a leading cause of death and disability worldwide, but the good news is that it is largely preventable. By understanding the risk factors and making healthy lifestyle choices, we can significantly reduce our chances of experiencing this devastating event. Remember, knowledge is power. Share this information with your loved ones, raise awareness in your community, and together, let's combat this preventable crisis.